I have a bag of primary fluid here. Your primary fluid is a medication, so you need to check your order. If your hospital or institution uses a scanning system, does everyone have a scanning system at their place of clinical? Okay, so most places use scanning, so you need to scan the bag and make sure there is a little, okay, maybe this one doesn't have one, but it should have a barcode on it because this is probably just, yeah, this is just a demo.
It's right there.
So you need to, am I missing it?
Over here.
Oh, yes, I am missing it, thank you. So we do have a barcode on there that we would scan, and that is our double check to make sure that we have the right medication or the right solution for it. My tubing is going to come in a package. It's going to have a cover on each end, a cover over the spike and a cover over the end of the lure lock that connects to the patient. And those areas need to stay sterile. The rest of this you can touch, but those areas need to stay sterile. Okay? I'm going to open up my tubing. The first thing I'm going to do is I'm going to clamp off my tubing. Otherwise, I will lose control and potentially smell like cat urine, right? All right, then you're going to spike your bag. So normally there'll be a little bit of a cover on here. I'll pull off this cover, pull off the cover of my spike, and then making sure my spike doesn't touch anything else, push my spike all the way in until it reaches the little notch on the spike. You want to make sure it goes all the way down. These bags have been used a couple times, so there's going to be a little bit easier. When you have a brand new bag, sometimes it takes a little bit of a muscle to push it all the way in, but you want to make sure that you do get it all the way to the notch. Okay. Next thing you're going to do is fill up your drip chamber, about 1/3 to halfway through. Okay. If you've remembered to clamp off and fill up your drip chamber, the rest of this should be pretty easy. Okay. Now, the sets that we gave you guys, the IV tubing that we gave you guys is a straight set, meaning it doesn't have a cartridge on it. This cartridge goes inside a pump, not this pump, it's for a different type of pump. And each hospital will have potentially different pumps, and that means the tubing and the way that the cartridge looks, so in this one here, it's not even really a cartridge. It's just an area of squishy tubing that goes in and then rollers go over it to push fluid through. So we're not too concerned that you learn the ins and outs of a particular pump or a particular type of tubing because we don't know what you'll encounter in clinical or in your working life. But there are some basics. If you have a cartridge that has air in it, like this one does, and it's not just a strip of tubing, whatever way it hangs to gravity, turn it upside down. If you let it hang to gravity and prime it, the fluid will get to the cartridge, fall to the bottom, and this will stay filled with air. But when you turn it upside down, you start priming it, it's going to push all the air up and out. Because air in tubing is like the bane of nurses' existence. It's like, why is it beeping again? Also, note that there's a cap that usually is on the end here, and when you're priming, you can leave the cap on. It's one less thing you have to worry about not touching something. If the cap's on it, you can just, let it flip around while you're doing the rest of the stuff and not worry about it touching anything. There's enough room around the cap that air can escape while things are coming through. Okay, so now that I have mystery noises. All right, so now I'm going to start to open up my roller clamp, and you can see here in my, turn this around here, you can see, and then, I can't go up that high because that's higher than the bag, it's not going to flow. Using all the way through. Now with maintenance fluids, this is not a medication, so if you get some bubbles in there and you need to waste some of it to get all the rest of the bubbles out, it's okay. You can just get a new bag if they run out, a couple minutes earlier. Okay, so now that I've got all my bubbles out, you see like a little bubble like that there, don't kill yourself over that bubble, okay? It takes actually a large volume of air in the venous system, which is where we're going. Probably at least 5 to 10 milliliters of air all at once. Little bubbles will dissipate. So if you have like a tiny bubble, if you have a stretch of tubing that has an air bubble in it, you definitely want to get that air out. Okay, so now I can set my pump. We're not in lab concerned that you be able to set any of these pumps here because you may never come across these pumps, but you do need to be able to state, especially when you're doing a medication calculation, the kinds of things that we did with like that one question on the quiz, like you have a medication that has to go over this amount of time and it's this volume, what would you set your pump for? So don't be worried about actually doing these, just be able to speak in pump, and pumps only speak in milliliters an hour. Okay, so now I can connect this, excuse me, to my patient. If the patient's IV hasn't been running for a while, we'd want to flush it first to make sure that it is still patent, that it's not infiltrated. If it's a central line, we're going to aspirate as well, making sure we get a little bit of a blood return before we do that. How much do we flush a peripheral with? Peripheral IV? Peripheral IV, you only need 3 to 5. It's a short IV. Central line, 10. We want 10 because it's going to be a much longer length of IV. Okay. Other thing that we need to do here with your tubing is label it. So we do have some nice labels. These are the ones that they use at UIH. At UIH, the standard, their policy is that IV tubing is good for 4 days. So if I was starting an IV or starting a new tubing on Thursday, I would grab the Change Monday sign and put it, you want it just below the drip chamber. Don't cover the drip chamber because the drip chamber can be useful to make sure things are actually moving along. But just below the drip chamber, put it on there. If you don't have one of these fancy stickers, just a piece of tape with the date and time that you hung it up is fine as well. Because if I come to this IV tubing and I'm starting my shift and this IV tubing has no label on it, I have to assume that it's old because I don't know and I have to change it. Because once you get past 4 days, the risk of infection and colonization within this line goes up and we don't know how long it's been there. And it's really, really easy to change an IV bag. You just pop it off, put a new one on. It's a lot more difficult to have to reprime everything. A lot more time for nursing, which we don't have a lot of time of as it is. It's also expensive. This tubing is pretty expensive. So make sure that you label your tubing. Okay, so now we've got our fluid going and we'll pretend it's in this pump, okay, just for purposes of demonstration here. And now we need to hang up a piggyback. So I've got my piggyback medication and I've got some piggyback tubing. Now, my piggyback tubing, you will note, is much shorter. Piggyback tubing is shorter, and it does not have any ports. Standard IV tubing in a hospital setting is going to have 2 ports for primary tubing. One port is going to be above the pump. What do we put up here? What goes to this port? The piggyback, there you go. The piggyback goes above the pump because we want the pump to control the piggyback when it's running. Then you have the port that's really close to the patient. What's this one for? IV push, there you go, good job. All right, so I've got my tubing. Once again, I'm gonna open it up. The first thing I'm gonna do is clamp it off so I can maintain control. It will have covers on each end when it's brand new package, and it will come with this little hangy thing. What is this for? To lower the primary. So it comes with the piggyback tubing. That gets confusing when you're first working with it. It comes with the piggyback tubing, but it's to lower your primary. All right, so I'm gonna lower my primary down with this tubing, or that little, I'm gonna clamp this off here. I'm gonna get my medication. And now I have to check compatibility because this and this are gonna go in the same line together. If I just have normal saline, I'm good to go. If I don't have normal saline running, I will have to check either in my drug reference. If it's not in your drug reference, you can always call the pharmacy of your institution. They have more stuff at their fingertips there. I've determined with this imaginary situation that I do have compatibility. So I'm gonna go ahead, pull off whatever little cap's on here, pull off the cap on my spike, and spike it, okay? Now you can prime it the way that we just primed this, where you fill up the drip chamber, open up the clamp, and let stuff run out. But the issue with the piggybacks is that this is a medication dose. If you waste some of it, if you get air bubbles, your patient might not get their full dose and therefore might not get in a therapeutic range for their medication. So the preferable way, which is much faster and easier, that I like to do, is to do something called back priming. So I'm still going to go to my same port. Notice I haven't primed any tubing yet for my piggyback. Just going to make sure everything's paused while I'm working with this. Just put my pump on pause while I'm doing everything. Okay. This should have one of those little caps on it, right? If it doesn't have one of those little alcohol caps on it, I have to use an alcohol wipe and scrub it for 30 seconds. And then I'm going to connect. Now what I'm going to do is I'm going to keep my piggyback bag a little bit lower than my primary bag and open up my piggyback tubing clamp. And what's happening is that some of that primary fluid is backing up into the tubing and filling it up. And now once I raise it above the level of the primary bag, it stops backflowing. So now this tubing is filled with some normal saline. So now I've primed it, gotten rid of all the air, didn't risk losing any medication, and it's super fast. So at this point then you would have to look at, let's say this is a cephalosporin antibiotic, it has to go over a half hour and there's 200 milliliters in there. What should I program my pump for?
400.
400, you guys are getting good. And you'll get better at it because you'll start to feel like, oh yeah, this one again. I see a lot of the same things over and over. Okay, also need to make sure I label this tubing as well because it's a separate tubing. And that's pretty much it.